Happy to welcome you all to our latest look at the state of Ohio operating budget deliberations and sort of where we're at in that process. Calling this webinar, What's in, What's Out, and What's Next. So we're going to cover some of the detail and policy related to health and human service provisions that are in the state budget, and then also dive into some of the sort of process pieces of this and how to engage in the state budget process. I will start with some of the classic sort of housekeeping items. I want to let you all know that we have our whole policy team here today to share different areas of what's going on in the state budget and the things that we've each been following kind of as we've gone through this process. So as they sort of begin their portions of presentations, they'll let you know who they are and kind of what they're experts in as it relates to health and human services and the state budget. Also just wanted to share that we will have an events, a landing page on our events portion of our website that will have everything related to this webinar. So the recording today, so, if you need to share this with someone or, it'll be available to folks who registered and weren't able to make it today. We will also have the slides downloadable as a separate attachment. And so there are definitely a few slides on here where you will not be able to take it all in. There's a lot of detail on some slides, so want to make sure that you have access to these after the webinar has concluded. We also have a couple of additional resources available related to some of the things we'll talk about throughout. So some of the committee activity that's happening in the State House and kind of how you can link to those different pages. So lots of information available on the event page for this webinar that will be available later on today. And you will all have access to that. We will be conducting all of the sort of chat and questions through the chat feature rather than the Q&A. So feel welcome to chat either to just the hosts and panelists or the entire group if you would like folks to see the question that you're asking. We will get to those questions toward the end of the webinar, and we should have plenty of time to get through them. So, pop them in there as thoughts come to you, but also, if things come up later, happy to answer those later on. And our team will do our best to tackle the questions. And if we can't answer them, we'll, kind of direct you to the right place. So let's get started. I am going to kick us off and then kind of pass it along to team members throughout, and they'll be introducing themselves. So for those who just joined, I'm Tara Britton. I'm the Director of Policy at the Center for Community Solutions, and we're going to dive into the current status of House Bill 96, the state's pending operating budget, what's in, what's out, and what's next. I have to get my mouse to pop up. Okay. There we go. So we're going to talk quickly about the high-level budget timeline. This is really just wanting to outline for you all kind of where we are in the budget process. You have likely seen lots of things related to state budget provisions in the news from us, from lots of other partner organizations in health and human services, and those who work around the state budget process. Here's the budget as it went through basically the House process. The governor produced his version of the budget in early February, and it went through a process in the House where there was sort of intense levels of testimony, went through a process that they, made their changes in the House, and it was voted out of the House of Representatives. It was very early in April, right ahead of the legislative spring break. And now we're in the Senate process. So we have moved into this bolded area right at the top middle where it says April, May. The budget is currently being deliberated in the committees that are serving as sort of budget committees that are hearing specific areas of the budget before it makes its way back over to the Senate Finance Committee here in a few weeks. And so we're here at budget deliberations in the committee phase. We purposely held this webinar at this timing so that it still gave you all time to engage in the budget process if you're interested in meetings or providing any testimony publicly via, being there in person or via writing. We wanted to give you all time to do that. So there is still a chance, and we'll talk a bit more about that as we kind of continue to move through this process. But we're heading toward June 30th, which is the end of the fiscal year, and we have to have a new operating budget in place by then. Okay, so we are actually going to spend more time on some of the more detailed and nuanced changes as it relates to health and human services, but I wanted to provide a couple of headlines so that it didn't feel like we were kind of ignoring these big areas that we know have gotten, I think a lot of write-up in the media. Certainly, lots of you have heard from your partners about some of these changes that were made. The version of the budget that the House passed in early April made significant changes to the school funding formula. I think that's one space where there was a lot of public testimony, a lot of folks weighing into the process about what that looks like. And while nothing is decided yet, there were significant changes in the school funding between the governor's introduced version of the budget and the House passed version of the budget. And this will certainly continue to be a topic of debate in the Senate Education Committee. One of the things, we will touch on this a little bit later, but wanted to sort of highlight that there was some shifting around and also removal of tax increases related to both the tobacco tax as well as sort of shifting how the marijuana tax is distributed both compared to the governor's version of the budget and compared to what the voters of Ohio approved when it approved legalization of marijuana. Stadium funding has certainly been a topic that has made itself known in the news. The House included a provision that would essentially provide a $600 million bond for the Cleveland Browns to move and build their stadium in the Brook Park region. That has been discussed, and so I know that will continue to be and has been a topic of debate going through the Senate process. One of the other things I just wanted to mention here that was a significant change, Community Solutions does not delve super far into housing policy, but certainly know how important it is, and the underpinning, of course, in terms of having a roof over folks' heads and keeping them healthy and safe and able to engage in work and school and healthcare and all of those things. There was a major change to the Ohio Housing Trust Fund that was included in the House version of the budget. Very surprising change, I think hadn't really been discussed when it was included in the budget, and would essentially substantially change the way that fund operates in terms of uh, removing the local focus of the trust fund and allowing local county governments and local county entities to really drive how those dollars are spent, and would kind of elevate this to a statewide program that would have less of a local impact. And so that's one other change that we know, we're keeping an eye on, but certainly working closely with our partners on. So those are kind of the big headlines that I just wanted to preface all of this with, that we know these are happening, these are big conversations, but we're going to look at a little bit more into some of the specific areas as it relates to health and human services. So I am going to turn it over to my colleague Brandy Davis, and she can introduce herself and then kind of dive into some Medicaid changes.
Thanks so much, Tara. We've got a lot in the Medicaid budget. My name is Brandy Davis. I'm a fellow in Medicaid policy at the Center for Community Solutions. I'm glad that everyone was able to join us today. One of the big things is that Medicaid, we call it so-called trigger language here at Community Solutions because it is actually a part of the budget. And we know that the budget is a legal document, and so that means something. So I'll walk you through some key revisions that happened in sub HB 96, what they mean, how they'll work in practice, and what you as Ohioans and even those helping Ohioans need to know. First, as we discussed the trigger language in the original budget, there was a provision that if the federal medical assistance percentage drops below 90%, and that's in fiscal year 2026 or 2027, now we've introduced this what's called a transition plan, which is great in this new budget as a transition plan, right? We won't just be eliminating people from Medicaid based on a reduction in the federal, what we call the FMAP, that federal medical assistance percentage. But we will be, the transition plan doesn't have a great amount of detail. We don't know what happens. We don't have a great amount of what we can look forward to in the transition plan. We just know that there is one. Great news that there is a transition plan, but great amount of detail would, or any amount of detail rather, would be instrumental in helping us really sort of fill out the transition plan moving forward. And so we know, like in this new budget, we have those remaining questions. What happens? Who administratively is going to facilitate the transition plan? What it will look like? How will we close these gaps? And as Tara mentioned, and she'll talk about further, we have some opportunity for testimony um, tomorrow, actually, and then also on the 15th. So we'll be looking forward to that. Tara will be providing some testimony tomorrow on behalf of the Center for Community Solutions, and we hope that you will join her at some point in time. As we look forward to, though, those continuous coverage for kids, we were really looking forward to that because, we've seen other states sort of look into this continuous coverage for kids, and it's been really instrumental in providing coverage. And Ohio passed a law and said, hey, like, we're going to do this. But now in our current budget, as it stands, we're not going to do this anymore. Um, and so, like, we would have had continuous coverage for kids from zero, like from birth, up until administratively, we call it 0 to 3. You'll hear that a lot, but administratively, it was zero until the first month of the fourth birthday because we have to have a cutoff somewhere. And so we had that in the budget, and that was wonderful, and we were making great gains, we thought. But that is currently something in the House budget that didn't make it. We struck that continuous coverage. And that's something at Community Solutions that we are definitely looking into and advocating for continuously. And next here. So we've got lots of things. As we look into the Joint Medicaid Oversight Committee, which is a committee that's comprised of both the House side, the Senate side. I mean, really, it should have some forethought there about the conversations that we have relative to Medicaid. And when we look at the Joint Medicaid Oversight Committee, they're getting a little bit more um, oversight, for lack of a better word. And also, there's a bit more bureaucracy. We can look to the Joint Medicaid Oversight Committee, and we're saying that they're going to have to look at. I mean, they're going to have to give full access to eligibility, billing, provider networks, and all their protocols, and they're going to have to deliver that to the Ohio Department of Medicaid every 6 months. And also some managed care organizations are going to have to file some financial documents, and that'll be sent to the General Assembly. And so we're looking at that oversight and how it will impact just the Joint Medicaid Oversight Committee's ability to operate. So by September 1st of each year, the Ohio Department of Medicaid will have to report on its staffing levels, related costs, and all those things. And then by December 3rd of 2027, the auditor of the state of who audits the Ohio Department of Medicaid and their next generation system will have to look at some performance and finance costs. And so we know that that's going to create, we don't know how that will happen, how they'll be able to produce those reports rather. But that's definitely some more complicated measures that we can look forward to. And then we have some changes in presumptive eligibility. When we're looking at presumptive eligibility, normally when you go to if you were, a general Ohioan who was presenting to a hospital, say with a broken bone and you didn't have health insurance, If you're presenting with a hospital to a hospital with that broken bone without health insurance, and the hospital, say you went to Metro Health, generally Metro Health would be able to, which is also a site for eligibility determinations, would be able to say, okay, this person has an income of this person qualifies. So we can presume this person's eligible for Medicaid and we'll be able to back bill, right? And so back billing is sort of looking back into like 90 days of coverage and say, okay, these costs, these services were provided, and this person was presumptively eligible. So they'll be able to um, we can presume they're eligible at this point in time. And I want to point out too, we'll answer some questions at the end. I know lots of people will have questions about Medicaid for sure, but we'll answer some questions at the end and we're monitoring the chat. But now, moving forward, adults without prior approval would need official Medicaid authorization before they were able to be, bill for hospital services or any type of services, uh, implying that they were eligible for Medicaid. And that's definitely going to be a challenge for a lot of providers if this remains throughout the Senate bill. And we'll talk about the process a little bit more at the end of this and what you can do at the end of this presentation. But um, ODM can no longer self-designate as a qualified health entity. And the auditor will uh, have to approve compliance within 90 days of the CMS approval. So that's definitely a change for sure. And we talked about that elimination of continuous coverage for kids. Um, when we talk about Medicaid and change in circumstances eligibility verification, that is quite the undertaking because verification now is going to be a little bit more complicated for folks. And we're looking at the fraud, Medicaid fraud. There are going to be penalties like 200%. So if someone is convicted of Medicaid eligibility fraud, they will have a 200% of the cost. So like whatever their fraud costs, it would be 200% that their restitution that they are qualified to pay. So for those services, and this is aimed to deter fraudulent claims. But we know that Medicaid is not a program that has a lot of fraud to begin with. So we're not necessarily sure that this is necessary. The next thing is that Medicaid buy-in for workers with disabilities. And this is actually, I'd love to end with this because this is an opportunity for folks, especially with disabilities and those who are striving to work and sort of change and implement things, right? So those with disabilities who are striving to work, they now, and we have two programs in Ohio. One is the Medicaid buy-in for workers with disabilities, and one is Ohio Workability, those programs. And so now, like, we're waiving the first $20,000 of their income in this current budget. And then also, in addition to that, participants in either of those programs who have incomes that exceed that 150% of the federal poverty level, they will have no annual premium, and that's really wonderful for that group of participants. And this change really lowers the financial barriers for Ohioans with disabilities who are striving to work. And as Governor DeWine mentioned in his State of the State, we want those workers who are able to work to be able to work. So we're looking forward to that change and hoping that it stays within the current budget. And so that's all of my updates. I do want to provide my email address. I'm bdavis@communitysolutions.com, just in case we don't get to some of your questions. And now I'll pass it off to my colleagues.
Thank you, Brandy. So my name is Natasha Techi. I'm the Troy Hall Fellow in Health Planning at the Center for Community Solutions, and one of my areas of expertise is maternal infant health. So the House had made some changes in infant and maternal health in their version of the state budget. So let's talk about the birthing center transfer agreements first. So the House added some language which requires a hospital with a maternity unit and also accepts Medicaid to have a transfer agreement with any freestanding birth center. However, that freestanding birth center has to be within a 30-mile radius of that hospital. The second thing that happened in maternal infant health our funding cuts, in particular with infant vitality and Help Me Grow. So for some people has not heard about infant vitality, well, that provides funding for local community-based and faith-based service providers to offer services, programs, and supports for pregnant individuals and birthing people in order to improve maternal health outcomes. And Help Me Grow offers various programs, but one of them is a home visiting program where a professional meets the parents and teach them how to have a healthy pregnancy, how to make sure that their baby or young child reach their developmental milestones, and also how to develop healthy relationship with them. Um, Due to the funding cuts from these programs, this could mean that there could be possible limited activities or other things community-based, faith-based, or community-based providers can do to help pregnant individuals or birthing people. And also limiting funding for Help Me Grow can reduce the number of people being served in this program. And finally, I'm going to talk about doula-related changes. Over the past few years, we at Community Solutions have been advocating for doulas to be reimbursed through Medicaid, especially during the last state budget cycle in which that language was incorporated and it became a permanent program. So the doula reimbursement program started in the fall, this past fall. However, the House added some language recently that would limit Medicaid reimbursements for doulas to only 6 counties with the highest infant deaths instead of all counties throughout Ohio, which poses a concern because this would limit the number of people who need doula services across the state, especially in counties that also have high infant maternal and maternal health death rates. So this is a problem that's going to happen throughout the state if we don't see any changes in that. So that is all for my end of the presentation. I will add my email in the chat, which is ntmicah@communitysolutions.com. And now I will pass it over to Dylan.
Thank you so much, Natasha. I'm Dylan Armstrong. I am a public policy fellow here at the Center for Community Solutions, and I'm going to be covering 2 of our 3 updates regarding behavioral health. So first, with regards to harm reduction funds and harm reduction in the budget, the House's budget had reduced the only source of dedicated general revenue funding that is used to support local health providers' harm reduction efforts. This usually comes in the forms of providing substances such as naloxone or syringe service programs. The governor's introduced budget originally had included $500,000 over the biennium, and that was reduced to a little over $315,000 in the House version. Also important for harm reduction, while not tied to any funding, is that the governor's introduced budget and also the House passed budget includes a provision to allow the Board of Pharmacy to approve or legalize additional testing strips outside of fentanyl test strips. Under current law, any testing strip other than fentanyl test strips are considered drug paraphernalia. So the Board of Pharmacy currently, if the budget passes as is with regards to this provision, will have the ability to approve additional testing strips, which is or just really good practice that'll work to save lives. The next piece of our behavioral health updates that I will cover is with regards to the block grants for the Adams boards. The House did maintain the governor's budget level of funding for the state block grants that are to be allocated to the Adams boards. This funding is, some of it is new, but most of it's already funding that they receive. But the really big thing is that these state block grants provide a lot of flexibility to the Adams boards. So this funding could be utilized for harm reduction, but overall will just be additional funding that they will have at their disposal to support all the important and great work that they do. And I will toss it over to my colleague Kyle to talk about the 988 Suicide and Crisis Lifeline.
Thank you so much, Dylan. Hello and good morning, everyone. I am a policy associate working at Community Solutions. I assist our great work that we're doing in Columbus to advance our policy priorities and strategies on a statewide level. I focus on behavioral health, but I also focus on issues related to the Health and Human Service Safety Net and also in relation to that touching public health. But right now, I'm going to go ahead and finish up this section on behavioral health and talk a little bit about the 988 Suicide and Crisis Lifeline. So in November 2023, just a little bit of context. So issue 2 passed in the election, and that basically legalized the legalized adult use marijuana. And so in the governor's introduced budget, there was the 988 Suicide and Crisis Lifeline will be funded using tax revenue from non-medical marijuana. And so in that funding source, it would be funded at 73 million over the biennium. However, in the House passed budget, the legislature proposed to divert these funds elsewhere in the budget at a reduced amount. And it basically cut the overall funding by almost half. Next slide, please, Tara. So when looking at public health, there are 3 major things that I like to share with you all today. Changes to the lead abatement and lead safe home fund are extremely notable in the House passed budget. These 2 line items are responsible for supporting a variety of work in the state, supporting lead prevention activities, hazard control, and housing rehabilitation. But both of these line items were substantially reduced in the House passed version of the budget. And in addition to that, I'd also like to talk about some major changes within the lead abatement tax credit. But first, let's start with the lead abatement and what changed in that. So lead abatement basically supports a vast range of abatement activities, or otherwise known as activities designed to reduce lead and how it impacts individuals and their well-being. And so in the governor's proposed budget, the lead abatement line item was proposed to fund the line item with a little over 7 million in the biennium, with 7.04 million in fiscal year 2026 and 7.04 million in fiscal year 2027. In the House passed version of the budget, this appropriation only received $250,000 per year, or otherwise a reduction of over 95% of the appropriated funds to the line item. The next thing I want to talk about is the Lead Safe Home Fund, which is a line item that allocates to local governments to undertake hazard control and housing rehabilitation initiatives. These initiatives are responsible for also expanding Ohio Department of Health prevention and hazard control efforts. So in the introduced version of the budget, the Lead Safe Home Fund proposed 1 million for each year in the biennium. In the House passed version of the budget, however, it was zeroed out in both fiscal year 2026 and 2027. That's probably one of the most significant changes that happened related to this work in the budget. And while the budget isn't finished in the Senate process, it definitely does call for people to use their voice to advocate for more funds or advocate for increased attention to those changes. Another area of significance in the budget is the lead abatement tax credit. And this tax credit supports property owners that acquire costs from lead abatement activity on eligible dwellings. And so basically the tax credit increases the maximum amount from $10,000 to $50,000. But one major thing to note is that the state of Ohio, the amount of tax credit certificates that are allocated is $5 million in the fiscal year. So the changes to the lead abatement tax credit increased the overall amount that individuals can incur from eligible dwelling, but it did not change the overall cap that the state of Ohio has. And so these changes passed in the House version of the budget. And I'd now like to pass it back to Tara to talk about the child tax credit.
Thanks, Kyle, and thanks, everyone. So rounding out on the sort of looking more closely at the policy changes, one of the things that the governor had included in his introduced version of the budget was a refundable tax credit of up to $1,000 for kids age 6 or under for low and lower middle income families. And we support the governor's initiative here. Refundable tax credits are very impactful and effective in terms of supporting families and really making those dollars go further in a family's budget. The proposed funding source for this tax credit, though, was an increase to the tobacco tax. And while from a public health perspective, that is also a really solid move in terms of increasing the rate of tax on tobacco products. Ohio has a fairly low tax rate on our cigarette taxes. We're about in the middle, but there are definitely lots of states who have significantly higher per pack cigarette taxes. So we're still pretty low. But that ended up being sort of the sticking point with the House of Representatives in terms of funding this tax credit. While based on some conversations that we've had with partners and folks in the General Assembly, we know that the legislature was interested in this concept of the tax credit for working families. They were not interested in raising the tobacco tax in order to fund it. And so both the increase to the tobacco tax and the tax credit, the child tax credit, were removed in the House passed version of the budget. So that's where we're sort of rounding out the policy focused areas. And now moving into kind of how we're framing this is an extension of some of the advocacy trainings and advocacy engagement opportunities that Community Solutions has offered sort of in person, but also, we've tried to do a pretty thorough job of issuing things in writing that kind of help folks track the budget along the way in terms of policy change, but also opportunities for engagement. And so we're taking the chance now to dig into some of the sort of direct activities happening in the Senate right now, since that's where the budget stands. So I will start with a little bit of just background level setting on how things kind of work from this process or this point in the process. As the budget moves through the Senate, where it sort of started in the main Senate Finance Committee a few weeks ago, and the Senate Finance Committee heard testimony from a few of the agency directors, but primarily from the governor's budget director, the budget focused folks who work in the legislature, and wanted to hear from them kind of their pitch on the budget. And then as it moves to the next phase, we move into this process of standing Senate committees. So, your Senate Health Committee, your Senate Medicaid Committee, your Senate Education Committee are essentially serving as budget subcommittees, for lack of a better term, but they're serving as specialized budget committees for the next couple of weeks to hear sections of the budget in a little bit more detail than the Senate Finance Committee hears them in. So as we move through these next few weeks, really began last week, but then moving into the next few weeks, it's those standing committees serving as specialized budget committees where they will hear from the directors of state agencies, boards, and commissions on the detailed proposals within their budgets. And then they move into the public testimony period where they ask to hear public testimony from the topics that they are covering in those specialized committees. So that's kind of this, the next few slides are going to help kind of lay that out for everyone to show you, if you want to sort of meet with members of committees or offer testimony in committees on some of these topics we talked about and others, these are the committees you'll go to. So here are the standing Senate committees that are serving as specialized budget committees. And again, these slides will be available on the event page as a separate downloadable option. And so you can see all of this information. You can download it. And as you will see in the next couple of slides, there are a lot of detail because we tried to outline for you which agencies are being heard in each of these committees, and some are hearing from a lot. So here are the standing committees that are hearing the specifics on the budget. So not every Senate committee will hear things on the budget, but these are the ones that will focus on different boards, commissions, and agencies, and then hear public testimony. So again, I'm going to run through these pretty quickly, but just so you can see kind of all of the topics that the Senate Agriculture Committee is hearing about. Some make, I think, sort of topic-wise, a lot of sense. The Department of Agriculture, some of the sort of engaging in the environment and things like that. But there are also committees that you may not expect that sort of landed in Senate Agriculture, like the Elections Commission or the Department of Transportation, motor vehicle repair. You might not necessarily think that those would land here. So it's we feel like helpful to share all of this information, and can also help you target if you are, writing letters or scheduling meetings. You would want to focus on the members of these standing committees serving as budget committees with your advocacy. Here's one, the Senate Government Oversight and Reform Committee is focusing on these here. We do know that the issues related to the Housing Trust Fund will be heard in this committee. This is also where anything related to the child tax credit. So again, it's not in the House version of the budget, but one of the things we are advocating for at Community Solutions is to reinstate the child tax credit as part of the budget process. And so our testimony related to that particular topic will be submitted through this committee because they're hearing testimony from the Department of Taxation and topics related to that. Senate education focus, you will see, I think I will say some of the committees that have to delve into a lot more policy detail. Not that there isn't a lot of policy detail in the other spaces, but I think there's a lot more changes proposed, obviously through Senate education. They're hearing from the Department of Education and Workforce, lots of big things and changes to talk about there. As we move through to health, there are several boards and commissions that live within the Senate Health Committee. All of the sort of health profession related boards live in this committee, are heard by this committee. But then also you'll see that some of the bigger agencies, Department of Children and Youth, Department of Health, Department of Job and Family Services, Mental Health and Addiction Services are all heard in this committee and have quite a bit of policy change related that will need to be relayed in these committees. Higher education has, obviously the Department of Higher Education and then a few of the other, sorry about that, issues related to higher ed in different ways, and then a couple of different agencies here. And then rounding us out is the Senate Medicaid Committee, where, obviously, Medicaid is an enormous piece of the state budget and has a lot of detailed information that is shared here. And in terms of just the dollar amount, there's a lot of focus here in terms of how much money from the state budget, both federal funding and state funding, go into Medicaid. So lots of delving into detail in this committee as well. So again, these slides will be available. You didn't need to write all of that down very quickly. They're downloadable later today, and you'll have access to kind of what committees are covering which boards, commissions, and agencies. So this is just sort of like level setting on the process, where, when, and how to engage. We suggest focusing on members and staff within the Ohio Senate for this phase of the budget, and expected that the budget will be in the Senate process through about up till about mid-June. I think they have planned to vote the budget out of the Senate on June 12th, so a little earlier than mid-June. But that's really where the focus is right now. That's where the activity is happening. So that includes calls, letters and emails, meetings, testimony. We're going to talk in a moment about how to submit testimony, and written testimony is, I think you obviously don't have the chance to interact as much if you're submitting written testimony, but certainly is, folks in the Senate, especially staff, are looking at that and then also see, if there is a large volume of written testimony on a certain topic, that says something to the members that, there are a lot of folks who care about this. But a reminder that once the budget is passed out of the Senate, the focus moves to the conference committee, where your audience in terms of advocacy is broadened back to members of the House, Senate, and to the governor's office. Typically, the conference committee is made up of members that come from the Finance Committee, where the budget is decided upon through the process in each chamber. So it will be the chair of the House Finance Committee, the chair of the Senate Finance Committee, usually also then the ranking minority member from each of those committees, House Finance and Senate Finance, and then another member from the majority in the chamber. So there will be another Republican member from each chamber as part of the conference committee. So it is a smaller, select group of folks, but if you have identified your champion on the issue that you're advocating for, certainly, making the point to them to continue to be a strong advocate for your issues with the members of that conference committee is really important in the phase that comes after the Senate budget. Okay, so I don't want to take up too much time on this, so I am going to go through it a little bit quickly, but just wanted to provide this information about how to submit testimony, whether it's written or you plan to be there in person. You do have to submit it to the committees ahead of time, and they have switched that process to an online process, which is very streamlined. But I think the thing to remember on this is submitting testimony is required and must be done no later than 24 hours before the start time of the committee that you want to testify in. So the Senate Medicaid Committee meets at 9 a.m. tomorrow. Testimony for that committee had to be submitted through this process that I'm going to walk through by, I guess, technically 8:59 a.m. this morning. And that is true of, all the committees that we're looking at. So it would need to be, just at that 24-hour mark ahead of when the committee starts. So here's the Senate website. You go into the committee drop down, and then you go to standing committees and find the committee that you're interested in. So again, you'll have access to these slides and you'll be able to figure out kind of where the topics are going to be covered that you're interested in. Once you get to that sort of Senate Health page that's highlighted here, you will go to the meeting tab at the top, and listed below will show the upcoming meetings. The next Senate Health meeting is, I think it's Wednesday this week. So I'm pretty sure I put this up on Friday, so it had sort of the most recent committee hearing posted here, but this gets updated and will give you the option to click on that date. And once you do that, it will show you this page. And there's a drop down option for the piece of legislation you want to testify on. You fill out this form, you upload your testimony as a PDF. And then there's an option, a checkbox to say if you're testifying written only or verbal and written. So if you're going in person, you want to check the verbal and written box to let folks know you'll be there in person and they'll call your name. So that's the online submission process, which is much more streamlined than it used to be. It used to involve kind of emailing the committee's office and making sure you had the witness form and everything. So the Senate has certainly upgraded the process in terms of the technology and the submission, but just a word of caution that cutoff time for submitting testimony is a harder point now because this online submission form gets closed if you're less than 24 hours out. So just a few guidelines for testimony. We talked about this. The timing is a little bit more stringent now in terms of getting it submitted. Be prepared to testify at any time after the committee starts. They may follow sort of the order that you see online once your testimony is uploaded to the committee page. They may follow that order, they may not. Sometimes you do have an option to put in any special comments or anything when you submit your testimony. And if folks let someone know that they, need to be out at a certain time or they traveled from out of town, those accommodations may be, they may attempt to accommodate them, but, just be prepared at any time once you're there. Keep your asks straightforward and concise, especially, I would say once they've heard testimony on a similar topic, make sure you're kind of like emphasizing the points that others have made, but point out some new things and different perspectives on those issues. They have been, we haven't heard specifically for the Senate process yet, I don't think, but in the House process, they had, 3 or 5 minute time limits for your actual testimony. And then, in some cases, they limited the number of questions that members of the committee could ask. So unclear on exactly how that's happening in all of the Senate committees yet, but just that's something to be prepared for. Be prepared to answer questions from the committee, but it's okay to say that you don't know. It's always, fine to say that that's something you can look into and get information back to the committee's chair's office, and they will share that information around with the group. Okay, so just as a resource, this is where we find all of this budget information. The Ohio Legislative Service Commission is sort of the budget arm of the legislature, and they provide completely unbiased information on, they actually do the analysis on all of the legislation, but of course the budget bill is very in-depth and requires some more research. So this is the page where everything lives. It's the Budget Central page. This is the 136th General Assembly. So this is the budget that's passing during this General Assembly, but you can also find past budgets on this same page. And this is where all of the information kind of goes, where we get all of our information on the different versions of the budget, the analysis of the different versions of the budget. You can see the appropriation spreadsheet, which will show you, the individual line items and how they change from the governor's version to the House version of the budget. And then you also have the opportunity here to find the comparison document, or what we call the comp doc, if you hear those terms, around Capitol Square. But this will show you the sort of language change from one version of the budget to the next. And so this is something that we pay particular attention to as we begin to go through this process of, things changing and policy and funding changing through the budget. Here is what it kind of looks like once you go into it in more detail. I happened to grab this page about hospital presumptive eligibility, which I know Brandy talked about earlier, but essentially this change around presumptive eligibility that would limit that option to only pregnant women and children there was nothing about presumptive eligibility in the governor's or the executive version of the budget. And so it tells you there was no provision related to this, and it was only a change made by the House. Here's the committee schedules very quickly. Again, you will have access to these slides, so you don't have to write all of this down. Senate Health Committee is still in the phase of hearing from the agency directors and the boards and commission directors. So no public testimony in Senate Health this week, but on Wednesday and Thursday, these are the agencies that they're hearing from. Senate Medicaid has moved into the public testimony phase. And so tomorrow is the first day for public testimony, although I saw on the notice they still may be hearing some information from some agency directors because they can call them back at any time and ask them more questions. But then they will also have an opportunity for public testimony next week. So, probably for anyone who wants to testify on Medicaid who isn't on the list for tomorrow, that will be your opportunity. And then moving into just a few of the other committees that I figured folks might be interested in seeing kind of the outline here. Senate Government Oversight and Reform, again, still hearing from offices and agencies this week. And then Senate Education is having invited testimony from a couple of boards this week, but they are also hearing what looks like a panel on Wednesday around school funding and then public testimony. You will notice that this committee begins at 4 p.m., so I imagine that one will go a little late into the evening. And then I know that Senate Government Oversight and Reform's public testimony takes place the following week and also begins very late. I believe not until 6 p.m. So some of these public testimony opportunities, I think to some extent they may be accommodating work schedules if folks are coming to testify as not part of their work, but it is obviously a little bit challenging, especially for anyone who has to travel to Columbus. Okay, so here are all of our pictures, and we can put our contact information in the chat. for any specific follow-up questions that we don't get to in the next 10 minutes or so, but really appreciate you all joining today and happy to take questions. I actually will probably stop sharing so that I can see the chat easier, but I'm sure folks have been monitoring it while we all have been talking. Okay.
So we've got a question from Julie that I'd like to address first off.
Go for it.
Just to add a little bit of nuance. So Julie asked originally, she asked two questions. But one of the first that I think I can address is, can you please say more about what the transition plan, and she focused on specifically for those who lose Medicaid expansion, might mean for people who rely on Medicaid for life-saving prescription drugs. And as it currently stands, we don't have a lot of information about the transition plan, Julie, unfortunately. So we don't really know. It could mean lots of things. It could mean if there isn't much of a transition plan or more details, it could mean lack of access to those drugs or medications. And if there are more details in the transition plan, it could mean that people have an opportunity to transition their medications or find another method of funding for those medications, or at least look for another method of funding. So stay tuned and we'll continue to follow this and see what that really means as we enroll the transition plan, if that stays within the budget.
Thanks, Brandy. I'm catching up on the chat, so if folks have things they want to jump in on, go for it. Looks like some things have been answered in the chat. And I did see the question about, certainly we're sharing the slides, so I think some of that will be answered there.
Yeah, I can jump back in again just to answer this question relative to the Medicaid trigger language. Is there any hope that the Senate will change it? What is the Ohio Medicaid Matters Coalition doing at the moment? So the Ohio Medicaid Matters Coalition, glad you asked about that. They're a coalition focused on, we have more than 80 organizations at this point, and we're really focused on changing the language from shall to may, just to give a little bit more, like at least that's the first focus, just to give a little bit more flexibility to the legislator to be able to say, like, we can do this and maybe we won't. So that's that. And for anybody who's interested in the Ohio Medicaid Matters Coalition, I actually had that up recently. I was going to give you a little bit of wherewithal. So it's just a coalition that really has a focus on making sure that we maintain that Ohio Medicaid really does matter. We're a proud member of the coalition from Community Solutions, and really dedicated to the work that we're doing. As it's currently happening, what we're asking is we want as many Ohioans as possible to have health care that they need to work and thrive. And we're asking lawmakers to enable just some flexibility and change in that trigger language, so to speak, in the bill from shall to may. So, and you can go to ohiomedicaidmatters.org to find out more just about our work there.
Okay, I see a couple of questions about which committees will be hearing things. So anything tax related, even if the benefit is to children and youth or health, anything tax policy related will be heard in Senate Government Oversight and Reform, since the Department of Taxation is being heard in that committee, and that's where sort of the language lives in terms of the budget. So I see that question related to child tax credit, as well as the cannabis related revenue conversations are happening in Senate Government Oversight and Reform. There were a couple questions about, so I would say that a couple of other questions about where things will be covered. Anything Medicaid related, so all of the things Brandy talked about, and the doula change, specifically because it's related to Medicaid coverage of doula services, will be covered in the Senate Medicaid Committee. The Help Me Grow piece will be covered in the Senate Health Committee because it lives in the Department of Children and Youth, which is covered over there. Which, all of this is to say that it is very hard to separate these areas out, knowing that certainly revenue conversations impact the ability to support these health and human service conversations. So I think in our advocacy and certainly in the way we talk about many of these things, there's a lot of overlap, and we try to make those connections the best that we can. But we will be submitting testimony in Senate Government Oversight and Reform, Senate Medicaid, and Senate Health to cover, the gamut of things that we work on. It looks like you all answered a lot of things in the chat. I will say, I think on the Medicaid trigger language, that sort of shall to may change is the most straightforward way to sort of get it done, right? And it did seem like there is a little bit more willingness to have that conversation with members of the Senate in terms of creating some softer landing there. So if we change it from shall to may, like Brandy said, it gives the state a little bit more flexibility, and that does seem a little bit more. There are folks more open to that conversation in the Senate on both sides of the aisle. Committee that will hear testimony on lead abatement, lead safe program, that will be in Senate Health. So it'll be interesting, I think, to see the testimony from the Department of Health this week on those issues, because we have not, this will be their first chance to talk about the changes the House made. And so, certainly they will be asked questions from members of the committee about the significant changes to those line items. There's a couple of questions here about just sort of like insight into the thought process of some of these changes. And certainly many of us are having those conversations with members of the legislature. There's a lot of comments from members of the legislature as well as members of the DeWine administration saying, we have to be ready for federal changes coming. And there is obviously the Medicaid language around Medicaid expansion and potentially pulling back on that if federal changes are made to the matching rate. There is also language in the budget that would allow the legislature or the state of Ohio to essentially pause on other programs that receive federal funding to assess how to move forward. It is not an outright end to those programs as the Medicaid language states, the Medicaid expansion language states, but certainly this is on the minds of everyone deliberating the budget right now. The other thing I will say on some of the, I think, Medicaid changes in particular, outside of the trigger language, there was some desire for streamlining. And I think we could all certainly debate what the most effective or efficient definition of streamlining is as it relates to governing. But there was some effort by some members of the House of Representatives in the state to recreate some of the work happening in the Department of Government Efficiency at the federal level, sort of looking at things, trying to understand if they are having the impact that they have. I don't know how much of that all went into the decisions to make some of the Medicaid changes. They were definitely about sort of efficiency and streamlining, but the result of that is up for debate. So that's, I think, the effort that we are all still engaged in the Senate process to really unpack what some of those changes mean practically and for real people, and outlining that for members of the Senate. I don't know if I quite got to everything. Appreciate all of the questions, and we will download this chat and make sure that if we need to follow up with folks on anything, we can do that. Certainly all of the information that is in the slides, you'll have access to pretty quickly. Again, that sort of there are hearings tomorrow, but Senate Medicaid is the only one that's hearing public testimony. And probably what I failed to mention is you can watch all of these online too. So if you don't need to be there in person, you can go to ohiochannel.org and watch any of these committees online, live, or after the fact. So usually very helpful tool, and hard fought, I think, in the pre-COVID days to get everything online. So glad that that is an opportunity, but certainly, look forward to engaging with you all. Please let us know if there are questions. We are happy to help guide through this process. And anyone have anything that we missed? It is just now noon, so we hit our time. Okay. Well, thank you all so much for joining today. I think you'll get, the links and things, but there are a couple of resources in the chat here that you can grab before we end the webinar, and really appreciate you all joining. Good luck in the next few weeks, and reach out if you, want to chat or need any help guiding through the process. We're here for that, and appreciate you all. Thank you.